Within our home, we do all sorts of interesting health-related behaviours. We sleep, we eat, we socialise, we're sedentary, we read, we watch television, we play video games, we move around, we're mobile, we climb stairs, we go downstairs. So lots of interesting health-related stuff happens at home. And the other thing about home, it's a place that you can put stuff to measure that. And one of the big problems with research in this space is that if you said, for example, why do children overeat at home? Okay, nobody really knows. Okay, because how do you measure that? How do you do that experiment? Would you take a child into a laboratory and get them to pretend that it's home and see how many biscuits they ate or something? So these are really difficult experiments to do. And one of the reasons that we're not very good at reducing the burden of a lot of these diseases is that we actually can't, they're not well suited to be measured. I mean, you know, if we're interested in measuring cancer, which is something I used to be involved in, we can take someone into hospital, give them an X-ray, and we can see the cancer, and we can kind of understand something about the evolution of that. But that is trivial compared with understanding why children eat biscuits, for example. Okay, and why, you know, is it because they enjoy the sugar, that they're lacking something else, that they're distracted, they're watching TV, and that means that they tend to snack quite a lot, or that meal times are not really had so much with families anymore, people eat individually. Nobody really knows, because it's a very difficult, much harder to work that out than to measure a 1 millimeter cancer, for example. So the home is lots of place where we exhibit lots of interesting health-related behaviours, and we can start to put some of these digital technologies that can do some measuring. And the technologies that Sphere has been looking at are kind of environmental sensors that measure things like temperature and humidity, so things to do with a house environment. Wearable sensors, so like a wristband, which I'll talk a little bit about, which tells us a little bit about the activity of the individual. We measure some things to do with the infrastructure of the house, things like electricity and water use. And we also have a video system that doesn't record video or watch people. It does things like it records information like someone is sitting or someone is standing. So between all these devices, we can try and we can get an awful lot of clues as to what people in the house are doing. To give you an example, if somebody, let's say, is at the early stage of developing dementia, one of the things that is thought to happen, but nobody really knows, is that as they start to use their cognitive function, their brain capability, they start to simplify the tasks they do, because complex tasks take a lot of planning. Think about one of the most complicated tasks that you can do in a house is actually preparing a meal. You have to choose all your ingredients, you have to make sure you have the right quantities, weigh them out, prepare them in the right order, set the temperature of all the appliances you're going to use, do things, you know, chop them, fry them, bake them, whatever. So complicated meal preparation actually is a really good sign of someone's cognitive capability. And probably what happens as people develop cognitive impairments and dementia is that they slowly start to simplify those tasks, and they'll start to choose easier things to make because the complicated things are really hard. Nobody knows. It's probably actually one of the best signs that we have of really, really early onset dementia. But again, how can you measure that? But actually, the Sphere system can measure that. So, for example, if we measure electricity use in the house, we can see the oven come on. If we measure water usage in the house, we can detect the use of water that's involved with most meal preparation. We can see humidity rising in the kitchen as the meal is prepared. And obviously a simple meal will have very simple signatures, and complicated meals will have many of these events with water being used and humidity changing and temperature changing. And with the wearable, we can actually also work out who's doing that. So just knowing a complicated meal in the house is being prepared is not very helpful unless you know actually who's doing it. Okay, so you can start to see how by adding up lots of tiny little trivial pieces of information, like how humid is the kitchen, we can start to get quite interesting and unusual information about health-related behaviours that doctors and scientists never had access to before. So if you were to ask a doctor, you know, how do you think patients change their cooking behaviours in the early stages of dementia, they would have no idea. They could tell you what their brain looks like in the early stage of dementia, but knowing what they do at home, not a clue. And that's a really big missing piece of our understanding of a lot of diseases. So that's the inside of a Sphere wearable that sends information. It's a wrist-worn wearable, and it sends information to the house. We make environmental sensors as well. That these measure humidity and temperature. That's the wristband in use. It looks like kind of like a smartwatch, but it's been very specifically designed for the type of work that we're doing around health-related behaviours. This actually is some of the systems installed in a house that we have in Bristol. So you can see they're quite unobtrusive. We can just put these little boxes down here and do these types of measurements. So it's nowadays possible to do this really quite cheaply and quite inconspicuously. And that's actually the camera. I'll say more about the camera and why we have a camera and what it does in a minute. And you can just see it's just perched here, and kind of just around the corner of the sofa, you can just see the edge. There's a little tiny computer, which is about so big, that's just stuck to the wall with Velcro. We can't and we don't want to record video, because apart from anything else, we don't want video. So imagine somebody was interested in someone's cooking behaviours. We can't really approach that by gathering video of them cooking every single day for a whole year, because who's going to watch the video and write down the answer? So not only is that ridiculously intrusive, but also actually ridiculously useless as well. But what the video system can do is it can tell us, for example, where people are. It can build a part of this picture as to, are they standing, are they in the kitchen? So what the video system does is it records just silhouettes of people and basically localizes them within the house. So this is a BBC presenter who stayed in the house. You may have seen the program on television a few weeks ago, and she is moving from the kitchen to the hall and the living room. And you can see that kind of this is fairly safe for her. It's practically impossible to identify her. I know who this is, but you won't know unless you saw the TV program. But that little piece of information is enough to say she's sitting, for example, or enough to say in the previous one that she was in the kitchen, stood by the cooker. So that's meaningful and useful information. This behaviour at home component, this understanding is completely missing from all these diseases. So we say about managing asthma. So obviously air quality in our homes is a really big component of asthma. Obesity, factors related, for example, how does your sleep quality relate to obesity? There's evidence, for example, that household temperature is associated with obesity. There's some evidence that people at risk of obesity, the increase in obesity is partly to do with an increase in average domestic temperatures, because obviously our houses have got a lot warmer over the last 30 or 40 years, thank goodness. It makes us more comfortable, but it may have had another effect. And we don't know. These are really simple things. Imagine if we could cure the UK's obesity epidemic by just getting everyone to turn down their central heating 2 degrees. That would be a pretty cheap win, right? So that's got to be better than spending billions of pounds on medication and courses and even surgery in some cases. How is sleep affected by air quality? We think it probably is. There's almost no data on this. A lot of us have had the experience perhaps of waking up when it seems stuffy in the bedroom, and that may seem like quite a trivial thing, but what if there's a whole load of things that are happening while you're sleeping that are not bad enough to wake you up, but your sleep quality is actually being degraded by just things like carbon dioxide in the atmosphere? And again, we don't know. Okay, it's probable that is the case. When an elderly person falls and fractures a hip, that's a life-threatening event for about 1 in 3 elderly people. So the over 80s, if they fall at home, for example, a hip fracture is, I think, about half of them never come back out of hospital after that event. And at the moment, there's a lot of interest in detecting falls. I don't really have very much interest in detecting falls. What I'd like to do is spot the people who are about to have the falls before they have the falls. That would be a bit more useful. I'm not going to go through all this list, but in every single one of these really, really major health conditions or health-related conditions, we are missing this piece of behavioural information, and so it is actually really important. In 10 years' time, everyone understands that healthcare won't look the same. It can't. We can't carry on doing the things that we're doing. And if you look at the NHS's 5-year forward view and all the policy documents, they're all saying that we need to think of new things. The UK's Chief Medical Officer is on record talking about the importance of using wearable technologies seriously, not just for jogging, but actually seriously.